I also have an app, a cough sensor, and it's supposed to analyze your cough and diagnose it. And of course, you're instructed to see a doctor for a in-person diagnosis. It's just taking my baseline now. Once it has that, then it should be able to tell me what's going on.
Tenho também o telemóvel e o relógio inteligente que me dá informações da minha saúde, quer medindo a tensão arterial, quer medindo o batimento por minuto, quer o oxigênio do sangue, quer os passos, quer todas estas informações que são úteis.
Simply not getting enough oxygen when you need it. And I try and try and try. I've probably got 10 of these little doohickeys sitting around the house, pulse oximeters.
En dat betekent dat ik bijvoorbeeld mijn longfitness gebruik, met name de krachtoefeningen gebruik, om te zien, om dat als maatstaf te zien voor de conditie bij een longaanval. Dan gebruik ik, meet ik min of meer de snelheid waarmee ik daarna weer tot een oud niveau kom, of net daaronder. Dat je helemaal terugkomt op hetzelfde niveau, dat is inmiddels wel duidelijk.
I feel pretty well today. No problems with breathing. A little cough, a little mucus, but nothing that I'm worried about. As a matter of fact, I feel pretty well physically.
Much, much shorter breath, and obviously using pulse oximeter, it showed that my oxygen levels were dropping far more quickly and lower than usual, simply by walking from one room to the other.
Usually an exacerbation for me means that I had some sinus infection, and we try to keep it from going to the chest.
Sputum, well, it gets, I always find, a couple of days before, which gives you a warning. It'll start getting thicker and browner and more plentiful. If I've got my wits about me, that's when I move up.
If you feel an exacerbation coming on, you must get help. You need to contact your doctor. And my PCP pretty much understands my COPD, and they're easier to get in touch with.
I usually pretty much know when things are working and when they're not, and I communicate to my doctor that, you know what, I'm taking this. It doesn't seem to be helping me.
I have an exacerbation. It affects my mood. I don't want to really engage with anyone. I just want to rest and do what I need to do to take care of myself, and that's about it.
Handle it immediately. Don't wait. The longer you wait, the more you're going to get hospitalized. If you have an infection, it's going to fester. It's going to get worse. You need to deal with it. And that's how you cope with it.
It's very easy to panic, and that just leads to things being worse. And I know a lot of people still do panic. So try not to. Breathe steadily. Relax as much as you can. Drop your shoulders is probably one of the most important, because everybody hunches up.
In mijn longaanvalsplan staat welke medicijnen ik moet nemen onder welke omstandigheden. Daarnaast, en ik heb die medicijnen ook in huis.
And you and your physician complete the personalized action plan together. And that tells you, are you having a green day, a yellow day, a red day? It helps you understand at what point do you say, well, let's wait till tomorrow, or do I message my doctor, or do I call my doctor, or do I go to urgent care, or do I go directly to the emergency room?
I don't have a rescue pack because the GP doesn't believe in them. I don't blame him really, because it really needs to know what's in there.
And said, here's how I present, and can I start using my emergency pack? Because I have antibiotics and oral steroids already at home provided to me by my physician. He said yes, and I started taking them, and it took care of the problem right away. I nipped it in the bud.
I tended to try to tough it out, ignore it and it'll go away or whatever. Now I know that once I start to feel the least little bit dizzy, or I have the least amount of discomfort, especially in my face, my forehead and my cheeks, whenever I start to get that discomfort, then that's the time to keep a close eye on the color of my mucus, so that I don't go into a bad exacerbation.